You have probably been told the same thing many times. If your back hurts at your age, you just have to live with it. Take your pills, rest when it flares, and be careful. But what if that advice is only half the story? And what if relying on medicine alone is quietly making your back weaker instead of stronger? All over the United States, seniors are being given more prescriptions for back pain than clear, simple guidance on how to move. Painkillers can numb the pain for a few hours, but they do not teach your spine how to support you when you stand, walk, or get out of bed. In some cases, they can even hide warning signals long enough for you to move in a way that your back is not ready for. Imagine if instead of adding one more pill to your day, you could give your spine a daily treatment from the inside. Not through force or heavy workouts, but through gentle movements that bring blood, oxygen, and stability back to the tired joints and discs in your lower back. That is what this video is about. How to start stopping back pain without medicine, using realistic exercises designed for seniors, with a special focus on spine stability rather than brute strength. My name is Dr. Robert Ellis, and for more than 20 years working in geriatrics, there has been one clear pattern in patients over 50 with back pain. The people who learn to move, even a little, tend to do better than the people who only rest and rely on pills. Not because they are tougher or younger, but because their spines are getting the signals they need to stay alive, nourished, and supported. Large clinical guidelines for chronic low back pain now recommend exercise and staying active as frontline treatments, even for older adults. That includes simple activities like walking, gentle strengthening, yoga, or core stability training. These are not extreme sports. They are basic movements that help the deep muscles around your spine coordinate better, improve blood flow to the area, and reduce pain over time. When you move, especially in a controlled way, 3 important things happen inside your back. First, your muscles wake up and learn to share the load so the joints and discs are not doing all the work alone. Second, blood circulation improves, bringing nutrients and oxygen to irritated tissues that do not have a strong blood supply of their own. Third, your nervous system begins to trust your movements again, which slowly lowers that constant brace and freeze response that makes everything feel stiff and fragile. Contrast that with relying only on rest and medication. Too much rest lets the muscles that support the spine shrink and lose endurance. Painkillers can reduce symptoms in the short term, but they do not rebuild strength or stability, and many have side effects on the stomach, kidneys, or balance, especially in older adults. So you feel a little better for a few hours, but your spine is not more prepared for the next bend, twist, or step. This is where the systemic enemy shows up. It is not you. It is not your age. It is the idea that the safest thing for an older, painful back is to be still, take medication, and avoid movement. That message is everywhere. Commercials, neighbors, even well-meaning family members telling you to sit down and do not overdo it. Over months and years, that message creates a quiet trap. You hurt, so you move less. You move less, so your spine gets stiffer and weaker. It becomes harder to stand up straight, harder to walk more than a few minutes, harder to carry groceries or climb stairs. The more you avoid movement, the more dangerous any movement feels. On top of that, our health system is built to treat pain quickly, A prescription here, an injection there, maybe a few sessions of therapy, and then back on your own. There is very little time to teach you how your spine actually works, what kind of exercise is safe, and how to use short, realistic routines at home to protect your back without living in the pharmacy. So the real enemy is a system and a belief. Pain equals damage. Movement is dangerous. Medicine is the only real treatment. This belief makes people over 50 underestimate what gentle, regular exercise can do for their spine, even if they have arthritis, disc problems, or a long history of pain. Under that belief, something else is hiding that very few older adults here clearly named. Your main problem may not be weakness or old bones alone. It may be a loss of spinal stability and movement confidence. Spinal stability does not mean a rigid, locked-up back. It means the deep muscles around your spine, hips, and abdomen are working together like a quiet support team. They turn on at the right time, in the right amount, to keep each small joint in your back from sliding or pinching when you move. When that timing is off, even simple movements can feel risky. You may notice this hidden condition in your own life. You can sit for a while, but when you stand up, your back catches or spasms for a few seconds. You can walk around the house, but a longer walk in the store makes your back feel tired, shaky, or untrustworthy. A light chore, like vacuuming or bending to pick something off the floor, leaves your back feeling far more sore than it should. This on and off pattern, where the pain seems out of proportion to the task, often points to unstable control, not just worn-out parts. The joints and discs in your spine may already have age-related changes, but the way your muscles support them can make the difference between manageable and miserable. When the stabilizing muscles are not doing their job well, your body tries to protect you by tightening bigger surface muscles. You feel hard knots, stiffness, and a constant urge to stretch or crack your back. Those surface muscles are working overtime, but without the deep support underneath, they cannot truly protect your spine during everyday activities. The encouraging part is this: stability is trainable at any age. The nervous system can learn, even in your 60s, 70s, or beyond, when it is given the right information in small, safe doses. This is where simple exercises for seniors, especially those that focus on spine stability, become a form of natural treatment. Not a cure-all, but a powerful tool alongside wise use of medicine when needed. Over years of working with older adults, there have been patients in all situations. People in their late 50s still working, people in their 80s using walkers, people who had given up on their backs completely. The ones who did best were not the ones who took the strongest pills. They were the ones who learned a small routine of gentle, targeted exercises, did them most days of the week, and slowly rebuilt trust in their own bodies. So when you hear the phrase, "stop back pain without medicine," it does not mean never take a pill or ignore your doctor. It means this: do not let medicine be the only tool in your toolbox. Use movement as a daily dose of protection and healing for your spine in a way that respects your age, your current pain level, and your fear. In this video, 3 practical paths will be shared that you can start at home: gentle walking, chair-based exercises, and simple spine stability drills that many seniors use to feel more secure in their backs. For each one, You will hear how it works inside your body. What research supports this kind of movement for older adults, and how it translates into real changes in your daily life. You do not need an expensive gym, special equipment, or a perfect body. You need clear instructions, realistic expectations, and a few minutes of movement most days of the week. That is how you start turning away from a life ruled only by pills and toward a back that feels more stable, more reliable, and more yours again. This is Dr. Robert Ellis. In the next part, there will be a walk through a structured list of 3 key strategies to reduce senior back pain without relying on medicine, starting from the easiest, lowest impact actions and gently building toward movements that have the greatest impact on your independence and long-term health. Let us move now into the practical part. 3 realistic ways to start stopping back pain without relying only on medicine, arranged from the lowest to the highest impact on your long-term independence. Strategy 1. Gentle walking, waking up the spine without fear. Mechanism. Walking at a comfortable pace is one of the simplest ways to bring life back to a stiff, painful spine. Every step creates a gentle rocking through your pelvis and lower back. This small, repeated movement tells the deep, stabilizing muscles around your spine and hips. Wake up, support, adjust. Unlike sudden twisting or heavy lifting, walking is a rhythm your body already knows. When you walk, your heart rate rises slightly, your breathing deepens, and blood flow increases throughout your body, including the tissues around your spine. That circulation helps deliver oxygen and nutrients and remove some of the waste products that build up when you sit or lie down too long. You are not wearing out your spine by walking. You are giving it the circulation it needs to heal and move more freely. Study research on chronic low back pain shows that regular, moderate-intensity activities like walking can reduce pain levels, improve function, and support mood and sleep, even in older adults. Guidelines repeatedly recommend staying active and avoiding prolonged bed rest because inactivity is linked with worse outcomes and more disability over time. Daily life relevance. For many seniors, the first goal is not a long, brisk walk. It might be a slow, 5-minute loop inside the house, or twice around the yard, or a gentle stroll down the block and back with a cane or walker if needed. The aim is to make walking a daily habit, not a rare challenge. Over weeks, that few minutes can grow to 10 or 15, and suddenly, errands, family visits, and social activities become less exhausting for your back. If you are afraid of pain, start where you feel safest, on a flat surface, in good shoes, near a railing, or with a walking partner. Walk just until your back feels warmed up, but not flared. Then stop, rest, and be proud that you moved. Strategy 2. Chair-based mobility and core support. Protecting your back while you sit and stand. Mechanism. The second way to reduce back pain without medicine is to train your spine in the position where many seniors spend most of their day, sitting and standing up from a chair. Prolonged sitting with a rounded or slumped posture lets the front of your spine compress and the back structures get overstretched, which can irritate sensitive tissues. Gentle chair exercises teach your back to hold a more neutral position and strengthen the muscles that help you transition from sitting to standing. A simple example is the sit-to-stand exercise. You sit in a sturdy chair with your feet flat and your knees at about hip level. Next, You scoot to the front of the seat. Lean your chest slightly forward, like you are getting up normally, and then push through your feet to stand up, using your hands on the armrests or your thighs if needed. Then, you lower back down with control. This movement trains your legs and your core to work together rather than asking your lower back to yank you upright on its own. Another example is gentle spinal mobility in the chair. You sit tall, cross your arms lightly over your chest, or rest your hands on your thighs, and slowly rotate your upper body a few inches to one side and then the other, breathing steadily. The goal is not a big twist. It is a small, smooth motion that loosens stiffness while teaching your muscles to control the range. Studies of exercise-based rehabilitation for chronic low back pain highlight the benefits of combining general strengthening with specific trunk control exercises. Even simple chair-based routines can improve pain and function when done consistently, especially for older adults who may struggle with floor exercises. Daily life relevance. Why does this matter so much? Because sitting and standing are two of the most common and most painful movements for seniors with back issues. If you can get out of a chair with more control, you reduce the sudden, jerky forces on your spine. If you can rotate gently in your chair without pain, tasks like looking behind you, turning to talk, or reaching for objects become less threatening. A short daily routine might look like this: 5 sit-to-stands from a firm chair, 10 gentle trunk rotations side to side, 5 to 10 seated marches, lifting one knee at a time while keeping the spine tall. Done slowly, with good posture and breathing, this can take less than 5 minutes and still give your back a useful wake-up call. Strategy 3. Spine stability exercises, training the bodyguard muscles of your back mechanism. The third, and often highest impact, way to stop back pain without depending on medicine is to train your spine stability directly. These exercises are not about big movements or heavy loads. They are about teaching the deep muscles around your spine, especially those near your lower back and abdomen, to switch on early, stay on gently, and share the work with the larger muscles. A classic example for seniors is the bird dog on hands and knees, which was discussed in another video. From a hands and knees position, you hold your spine in a comfortable neutral curve and then gently reach one arm forward and the opposite leg back, just a little, while keeping your back as still as possible. You are not trying to lift high. You are trying to keep your middle quiet. Another accessible option, if getting down to the floor is difficult, is a wall or counter version. You stand facing a counter, place your hands on it, walk your feet back so your body is at an angle, and then slowly lift one arm or one leg at a time while keeping your trunk steady. This still challenges your stabilizing muscles, but with less pressure on your wrists and knees. Study research on core stabilization exercises shows that controlled arm and leg movements with a stable trunk can increase activation of deep spinal muscles and improve pain and function in people with chronic low back pain. Guidelines support using these kinds of motor control or stability exercises as part of a broader program for adults, including seniors, because they improve coordination and confidence, not just strength. Daily life relevance. Think of how often your body asks for this kind of stability. Reaching into the back seat of a car, lifting a light laundry basket, stepping off a curb, while turning your head to look for traffic. In all of those moments, your spine wants those quiet bodyguard muscles ready. When they are asleep, you feel that sudden grab or spasm. When they are awake and trained, the same task feels smoother, safer, and less painful. A basic spine stability practice for a senior might be 5 to 8 bird dog repetitions per side, at the easiest variation that feels comfortable, holding each repetition for 3 to 5 seconds while breathing. Done 3 to 4 days per week, alongside walking and chair exercises. Over time, this builds a foundation that medicine alone cannot give you. Putting it all together, from pain relief to independence. If you look at these 3 strategies together, a pattern appears. They move from general to specific, from easiest to most targeted. Gentle walking brings life and blood flow to your whole system. Chair exercises teach your spine and legs to share the work in the movements you do every day. Stability drills tune the deep muscles that protect your back during more complex tasks. The goal is not perfection. The goal is a simple, realistic routine you can keep doing for months and years, not just a few days when you feel motivated. For many seniors, something like this works well. Most days of the week, 5-15 minutes of walking at a comfortable pace, indoors or outdoors. 3-4 days a week, a short chair routine, sit to stands, trunk rotations, seated marches. 2-3 days a week, a brief stability session. Bird dog or counter variations, focusing on quality and calm control. Over time, this kind of pattern can do more than just reduce pain. It can change how you live, being able to walk farther without a flare, get out of chairs without dreading the first few steps, and bend or twist without panic all add up to something larger. Independence. You start to say yes more often, to visiting friends, to going to the store, to standing in the kitchen and cooking for family. You rely less on others to lift, push, or carry for you. And perhaps most importantly, you rely less on a bottle of pills to get through an ordinary day. This is what escalation toward independence and longevity really means. Not chasing a perfect spine, but building enough stability, strength, and confidence that you can keep doing the things that matter to you for as long as possible. The science supports it, but more importantly, so do the stories of real seniors who chose movement as part of their medicine. Who you are is not a bad back. It is easy, after years of pain, to start thinking of yourself as someone with a bad back. That label can become heavy. It makes every decision feel smaller. I cannot travel. I cannot stand too long. I cannot play with the grandkids. But your identity is bigger than your diagnosis. You do not have to become a fitness person to help your back. You do not need to love exercise or enjoy sweat. You simply need to see yourself as someone who gives their spine a little bit of care each day. Not because you are chasing a younger body, but because you respect the one you have now. You are a grandparent who wants to be able to get down toward the floor, maybe not all the way, but lower than the couch, so you can be closer to a child without fear. You are a partner who wants to go for a walk after dinner without worrying about where the next bench is. You are a person who wants to wake up and think about the day ahead, not only about how bad your back will be. The exercises talked about here are tools, not tests. If you cannot do the floor version, You are not failing. You adjust to the chair or the counter. If you can only walk for 3 minutes, that is your starting line. The important part is that you are choosing to move on purpose for your own future. A gentle invitation to start. Stopping back pain without medicine does not mean throwing away your prescriptions overnight. It means adding something powerful alongside them. Consistent, thoughtful movement. You have control over that, even if your medical history is complicated. If all you do after this video is stand up and take a short walk through your home, or practice a few gentle sit-to-stands from your chair, you have already started. If you add 1 or 2 spine stability movements a few times a week, you are telling your back, I am here for you. I will not give up on you. This is Dr. Robert Ellis. If this way of looking at senior back pain makes sense to you, if it feels kinder, more hopeful, and more realistic than just take your pills and rest, consider liking this video and subscribing to the channel. That simple action helps more people over 50 find natural, safe ways to ease back pain and stay independent longer. You are not too old to change how your back feels. You are not too damaged to learn new movements. You are simply at a point in life where every small, consistent choice matters. Give your spine a few minutes of the right kind of movement each day, and let medicine become a support, not the only answer.